name is Purvis, and today I'm going to be demoing the insertion of an indwelling Foley catheter using sterile technique. So the first thing I'm going to do is review the physician's order. So we have Jake Nursing, a date of birth January 1st, 1960. He has no known allergies. This was written, today's date is February 7, 2021 at 07:36. It's been double signed and transcribed properly, and it says insert Foley catheter now to monitor fluid balance, so ins and outs closely. So once I've gone over that, I'm going to wash my hands and I'm going to verbalize that peri-care has been done for this patient. At this point, I'm going to gather my supplies and I'm going to head to the patient's room. So once in the patient's room, I'm going to do my entrance safety check. So I'm going to make sure that the patient's bed is in the lowest position, the call bell's within reach, the side rails are being used as appropriate, and the patient is in no distress. From there, I'll introduce myself. Hi, my name is Purvis. I'm a University of Manitoba student nurse, and I'm going to be inserting your indwelling Foley catheter today using sterile technique as per doctor's orders. So after that, I'm going to check the patient's wristbands. We have Jake Nursing, January 1st, 1960, so that's the right patient, and I'll get verbal confirmation of his birthday and his name. So after that, I'm going to ask him about allergies. He tells me he has none. That checks out with our physician's order, so we can go ahead. So at this point, I'm going to close the curtain to maintain the patient's privacy, and I'm just going to explain the procedure. So today, as per doctor's orders, using sterile technique to monitor your ins and outs, we're going to be inserting a tube into your bladder that'll be held in place with a 10 ml sterile water balloon, and it's going to be continuously draining urine into a drainage bag so that we can accurately document your ins and outs. So after I explain that to the patient and I have cooperation, I'm just going to raise the bed to the proper waist height. I'm going to raise the side table to the proper waist height, and I'm going to wipe down the table and let it dry. From there, I'm going to get my drainage bag out, and of course I would inspect to make sure this wasn't open, but for demo purposes, we've already opened it. And I'm going to hook this to a part of the bed that is not movable. I'm just going to pull back the covers here, and I'm going to attach this to the bedding for later use. So after I've done that, I'm just going to help the patient into the proper position. So this is a male patient, so we are going to put him into the supine position with his legs slightly abducted, as you see here, and we're going to place an absorbent pad under his butt. I'm going to expose the patient, just noting that the patient is in fact circumcised, and that means we won't have to retract any foreskin when we are doing the procedure. So from there, I'm just going to move this stuff to the end of the bed just because we don't have very much room during the procedure in these circumstances. So from there, I'm going to wash my hands and I'm going to open my kit. So in a clinical setting, this would be obviously closed and I would be making sure that the kit was intact, but for demo purposes, it has already been opened. So from there, I'm going to open my kit, making sure that I'm only touching the outside 1-inch border of the kit. Here we are, we're just going to grab the tweezers and open this. So from there, I'm just going to use my tweezers to grab stuff on the inside of this sterile packaging and set up my station here. So this is the garbage bag, and I'm just going to put this on the end of the bed to make sure that we accumulate any garbage that might come about from the procedure. So I'm going to get my first drape here. I'm just going to make sure I'm only touching the 1-inch border, and I'm just going to put this between the patient's legs. Okay, and then I'm going to get my other drape. Like I said, only touching the 1-inch border here, and I'm going to put this over the patient's genitalia. Okay, so from there, I'm going to grab my catheter, and I'm going to wing back the outer packaging, just making sure I'm not breaking sterility of the inner packaging here. And I'm going to put this into my boat. Okay, so I can go in the garbage. So from here, I'm going to perform hand hygiene, and I'm going to be applying my sterile gloves. I'm just going to be doing this on the end of the bed just because, like I said, we don't have very much room here. And outside of this, obviously these would be new gloves in a clinical setting, but these gloves have been used quite a few times, so I apologize for the outer packaging here. So I'm going to be opening this, ensuring that I'm only touching the outer 1-inch border. And we're going to start with the right glove. Okay, so there's that glove. Okay, and there's that glove. So I'm going to be throwing this in the garbage, and we can move on. So I'm going to be making sure that I keep my gloves above waist height to maintain sterility. So we're going to start with my boat. So I'm going to take the outer packaging of the catheter here off, and I'm going to inspect the catheter to make sure it's not defective, and it is good. So that is good. I'm going to open my iodine swabs here, and I'm just going to place them in the boat just for easier access when I am cleaning the patient. And I'm going to take my sterile water syringe here, and I'm going to be attaching it to my balloon port here. Okay, so there we go. I'm going to take a lubricating jelly here, and I'm going to open it, and I'm going to lube up the tip of my catheter here. Okay, so from there, everything in the boat is ready, so this can go in the garbage. I'm going to take my boat and I'm going to move it in between the patient's legs. So once I'm here, I'm just going to let the patient know that I'm going to be touching their genital area. So I'm going to grab the shaft of the penis with my non-dominant hand, and I'm going to start by cleaning. So we're going to get the alcohol swabs, and we're going to clean from the urethral meatus down the glands. And we're going to do this 3 times. Okay, so once the patient is good and clean, I'm going to grab the catheter with my sterile dominant hand here, and I'm going to instruct the patient to bear down as if in voiding, and to take a couple deep breaths as we insert. Okay, since this is a male patient, I'm going to insert 6 to 8 inches. So there's 6 to 8 inches, and then until we see urine, which we do now see urine, so I'm going to insert another 1 to 2 inches. So once I've done that, I'm going to move my non-dominant hand to stabilize the catheter as I inflate the balloon with the sterile water. So once the balloon is fully inflated, I'm just going to maintain palm pressure, and I'm going to tug gently until we feel resistance, which we do. At this point, I'll move my hand up without breaking sterility, and I will unhook that, and I will hook this onto the boat so that we can grab the tubing here. So once we grab the tubing, I'm just going to unhook that. I'm just going to make sure that I am not breaking sterility of this inner portion here. So I'm going to grab my catheter. We're just going to attach this. Okay, so once that's good and snug on there, I'm just going to perform pericare on the patient, making sure to get rid of any excess lubricant or cleaning solution. So after I've done that, I can attach the catheter to the patient's leg, and I can clean up my drapes. So I'm going to clean up any of the garbage that I've accumulated on the bed. From there, I would take off my gloves, and I would perform hand hygiene, and I would clean up my bedside table. So after I've done all of that, I'm going to make sure the patient's back in a comfortable position, and I'll do my exit safety check, so making sure the bed's in the lowest position, the call bell's within reach, the side rails are up as appropriate, and the patient is in no distress. So after I've done that, I will leave and I will document the procedure. So as per doctor's orders, using sterile technique, we inserted an indwelling Foley catheter to accurately measure ins and outs. So we inserted a 14 French catheter with a 10 ml sterile water balloon. It went in on the first try. The patient tolerated the procedure well. We documented the time that it was done. We are going to document that we got 250 mLs of pale aromatic amber colored urine upon insertion, which we will document on the ins and outs sheet, the IPN, and any other documentation that might be necessary. We're going to be back to monitor the patient for any signs of infection, as well as to make sure that we are dictating the proper ins and outs onto the ins and outs sheet that I just previously mentioned. And after that, I'm done. So at this point, I'm done, and I'm going to get a new doctor's order. So I'm getting the new doctor's orders for the removal of the indwelling Foley catheter. I'm going to assess the doctor's order for the reason. So the reason for this is the doctor thinks that the patient could void on their own. So after I've established that and I've looked over the doctor's orders and it all checks out, I'm going to wash my hands and I'm going to gather my supplies. So I'm going to get my clean gloves, my 10 ml sterile Luerlock syringe, and an absorbent pad to place under the patient's butt. So after I've done all of that, I'm going to get my supplies and take them to the patient's room. I'm going to enter the patient's room and I'm going to do my entrance safety check, making sure the bed is in the lowest position, the call bell's within reach, the side rails are up as appropriate, and the patient's in no distress. From there, I'm going to introduce myself. Hi, I'm Taylor Purvis, University of Manitoba student nurse, and I'm going to be removing your indwelling Foley catheter today using clean technique. From here, I will check the patient's wristbands. We have Jake Nursing, January 1st, 1960. I'll get verbal confirmation that this is the right patient and the right birth date, which it is, and I will ask about allergies. He says he has none, which checks out with our physician's order. From there, I'm going to close the curtain to maintain privacy for this patient. I am going to explain the procedure. So we are going to be removing the tubing that has been inserted into your bladder to accurately drain your ins and outs today, using, as per doctor's orders, using clean technique, because we want to see if you can void on your own. After I've explained this to the patient and he is cooperative with the procedure, I'm going to wash my hands and I'm going to help him into the proper position. So we're going to make sure the bed is raised to proper waist height. It's a male patient, so he's going to be supine with his legs slightly adducted, and I'm going to put an absorbent pad under his butt. So after I've helped the patient into the proper position, I'm going to wash my hands again, and I'm going to apply my clean gloves. These are now my clean gloves. From there, I'm going to drain the drainage bag. So we have 250 mLs of pale aromatic amber colored urine with no signs of sediment, which we are going to document on the IPN, as well as the ins and outs sheet and any other documentation that might be necessary for this facility. So after I've done that, I'm going to go to the patient and I'm going to unhook their catheter from their leg. Once I've unhooked the catheter from the leg, I'm going to get my sterile syringe, which I have here, and I'm going to attach it to the balloon port on the catheter. So from there, I'm just going to tell the patient to take a couple deep breaths as I deflate the balloon and withdraw all of the solution into my syringe. So once I know that I have all of the solution, I'm going to tell them to take a deep breath as I remove the catheter. Once the catheter is removed, I'm going to inspect the tip to make sure that it is still intact, and it is intact. I'm going to take the catheter, the syringe, and the drainage bag, and I'm going to wrap them in the absorbent pad that I've used for the procedure, and I'm going to throw them in the garbage. So after I've done that, I'm going to perform pericare on the patient, making sure that they're clean. After I've cleaned the patient up, I'm going to get rid of any garbage that I have accumulated from the procedure. I'm going to remove my gloves, and I'm going to wash my hands. At this point, I'll help the patient back into a comfortable position. And at this point, I'll also do my exit safety check, so making sure the bed is in the lowest position, call bells within reach, side rails are up as appropriate, and the patient is in no distress. So after I've done that, I'll just let the patient know that we're going to be back to monitor them every hour for the next 8 hours, just to make sure that they're voiding on their own. After I've done that, I can leave the room, and I'm going to document the procedures. As per doctor's orders, using clean technique, I removed an indwelling Foley catheter on our patient. We removed a 14 French catheter with a 10 ml sterile water balloon. It was, patient tolerated the procedure well. It was removed with no resistance. I documented the time so that we know accurately where 8 hours is, so that we know to monitor the patient within the next 8 hours to make sure they're voiding. I drained 250 mLs of pale aromatic amber urine from the drainage bag, and I accurately put that on the ins and outs sheet as well as the IPN and any other documentation. I'm going to be back to monitor the patient, like I said, within the 8 hours to make sure that they are voiding, and I'm going to make sure that we are monitoring them for any signs of infection, and then at that point I'm done.